Have you ever gotten two different diagnoses from two different therapists? Or maybe you're reading about complex PTSD and borderline personality disorder online and thinking, wait, I relate to both of these. What does that mean? If that's you, first, take a breath. You're not broken, you're not too complicated, and you're definitely not alone. I'm Dr. Bradford White, and today we're going to untangle the confusing overlap between C-PTSD and BPD. Now, I need to say this up front. I'm not here to diagnose you through a screen. What I'm here to do is help you understand these conditions better so you can have more informed conversations with your therapist and loved ones and feel less lost in the mental health world. Because here's what I've learned in my practice. Understanding your experience is the first step toward real healing. So let's talk about complex PTSD first. You've probably heard of regular PTSD, and that's what usually happens when your brain tries to process one overwhelming event like a car crash or an assault. Your nervous system basically gets stuck replaying that moment, acting like the danger never ended. Complex PTSD is a bit different though. This happens when you experience similar trauma that is repeated over time, especially when you couldn't get away from it. Think childhood neglect, ongoing emotional abuse, growing up in a chaotic household, or being trapped in a controlling relationship. If you're dealing with CPTSD, some of this might sound familiar. There's this deep shame that sits with you, not about anything you've done, but about who you are as a person. Trusting people almost feels impossible, even when they've shown you they're safe. You might feel disconnected from everything, like you're watching your own life happen from the outside. Your nervous system is basically stuck in overdrive. A door slams and suddenly you're in full panic mode. You might avoid getting close to people because it feels too risky. Or you do get close, but that safe feeling never really comes. Now let's talk about borderline personality disorder. And honestly, can we just acknowledge how misunderstood this diagnosis is? There's so much stigma around BPD, so let's actually break down what it really looks like. While BPD has its own distinct features, it's also important to remember that it can often co-occur with or be influenced by experiences like complex PTSD. BPD often shows up as this intense fear that people are going to leave you in relationships that feel like you're on a roller coaster, constantly up and down. It can definitely stem from trauma too, especially the kind that messed with your early sense of safety and connection. BPD involves specific patterns in how you relate to others, manage emotions, and see yourself, often including intense mood swings, impulsivity, and challenges with self-image. Here's what the emotional experience might look like. Your partner doesn't text you back for a couple of hours, and your brain immediately jumps to, they're cheating on me, or they're definitely leaving me, and maybe a little, I hate them and I never want anything to do with them again, but please at the same time, I hope they don't leave me. You might meet someone new and they seem amazing, until they do one small thing that disappoints you, and suddenly you feel like they're the worst person you've ever met, and you regret ever meeting them. Your emotions can shift really quickly and intensely. When you're in distress, you might do things impulsively to cope. Spending money you don't have, self-harm, binge eating, basically anything to deal with that overwhelming emotional pain. So here's where it gets really interesting, and where a lot of the confusion happens. Both conditions involve emotional struggles, relationship difficulties, and they often come from trauma. So what actually separates them? Think about it this way. CPTSD is mostly about what happened to you and how your nervous system is still reacting to that. It's like your nervous system got stuck in survival mode and hasn't figured out that the danger is over. BPD, while it can definitely be trauma-related too, is more about how those experiences change the way you handle relationships and emotions right now. It's less about being stuck in the past and more about having intense reactions to what's happening in your relationships today. Here's another example. Someone with CPTSD might avoid dating completely because relationships just feel dangerous, while someone with BPD might desperately want close relationships but find them incredibly chaotic. Loving someone intensely one day, feeling totally betrayed the next. Of course, it's not always this straightforward, but that brings us to something really important. What if you relate to both? I'll pass on the knowledge of one of my grad professors. She used to say to us, be prepared to see yourself in multiple diagnoses. They're just descriptions of human behavior, and guess what? You're human. Sometimes you're going to behave in all these ways. Trauma doesn't care about fitting into neat diagnostic categories. Your brain doesn't have a copy of the DSM-5. It just knows it went through overwhelming stuff and came up with ways to survive. So if you're reading about both conditions and thinking, yeah, that's me, and that one's me too, it makes total sense. You might have pieces of both. You might have been misdiagnosed at some point. Or you might have one condition that shows up in ways that look like the other. And honestly, the specific label matters way less than understanding what's going on in your inner world and getting the right support. So, what does recovery actually look like, regardless of which diagnosis fits? First up, you need trauma-informed therapy, whether that's EMDR, somatic work, DBT skills, or depth-oriented psychotherapy. You want someone who gets how trauma lives in your body and the nervous system. Second, learn to work with your emotions and your nervous system. This isn't about stuffing your feelings down. It's about having more choice in how you respond to them. And third, this is huge, developing self-compassion. Your symptoms aren't personality flaws, they're survival strategies. Your brain did whatever it had to do to keep you alive. The more grace, gentleness, and humor you can extend to yourself, the better off you and your loved ones will be. Teach yourself new ways of feeling safe in the world. Look, whether you're dealing with CPTSD, BPD, or something that doesn't fit cleanly into either box, I want you to know this. You're not hopeless, you're not broken, and you're not too much. You're someone who survived really difficult circumstances, and your mind and body did whatever it took to get you through that. And that's actually pretty incredible when you think about it. The fact that you're here right now, seeking understanding and asking questions, that tells me you're ready to move from surviving to actually thriving. And that journey, it's absolutely possible. You are perfectly imperfect. Your wants and needs matter. Your reality is valid. You're allowed to be spontaneous, and you are inherently worthy. If this helped you make sense of things, subscribe for more videos about trauma, healing, and understanding your inner world. And remember, healing isn't about becoming someone completely different. It's about becoming more authentically yourself. Take care.